How do liquid and chewable child medications work differently? Imagine giving medicine to a child and wondering why some come in liquid from while others are chewable tablets. Both are designed to help kids feel better, but they work quite differently behind the scenes. Let's explore how these two forms of medication differ in their formulation, absorption, and safety. Liquid medications are usually suspensions, solutions, or syrups. They are made to be swallowed easily, especially by very young children who can't yet swallow pills. Because they are liquids, you can measure the exact dose using a syringe or a dosing cup, which makes it easier to give the right amount. Liquids often taste sweet to hide any bitter flavors, but caregivers need to be careful. Too much sugar can lead to dental issues or accidental overdose if not measured properly. Liquids usually need to be stored in the refrigerator or at room temperature to stay stable and safe to use. Chewable medications are solid tablets that are designed to be chewed before swallowing. They are flavored with sweeteners and fruit tastes to make them more appealing to children who can chew safely. These are typically suitable for children aged 6 and older, as younger kids might have trouble chewing properly or might choke. Chewables are convenient because they do not require measuring and are more stable than liquids, which can spoil or separate over time. When it comes to how they work once inside the body, liquids tend to be absorbed faster. Because they are already dissolved or suspended, they go straight into the stomach and small intestine, where the body quickly absorbs the medicine. This means the effects can start sooner. Chewable tablets need to be broken down in the mouth and then dissolved in the stomach. The rate at which they dissolve can influence how quickly the medicine works. Some chewables start releasing the drug in the mouth, but most absorption happens after the tablet reaches the small intestine. Safety is another important factor. Liquids are great for infants and very young children who cannot chew or swallow pills safely. They allow for flexible dosing but requiring careful measurement and handling. Chewables are easier for older children who can chew well, but they are not safe for very young kids because of choking risks. Caregivers should always ensure the child can chew thoroughly before giving a chewable tablet. In practical terms, when giving over-the-counter medicines, it's important to consider the child's age, ability to swallow, and taste preferences. Use proper tools like syringes or dosing cups for liquids to ensure the full dose is given. For chewables, make sure the child can chew completely to avoid choking and to ensure the medicine is properly absorbed. Sometimes, caregivers mix crushed tablets with food or drinks, but they need to be careful to give the entire dose and not lose any medication. In summary, liquids work by providing a form that is quickly absorbed and suitable for the youngest children, while chewable tablets depend on the child's ability to chew and dissolve the medicine. Both forms have their advantages and limitations, and choosing the right one depends on the child's age, safety, and comfort. Always consult a healthcare professional for personalized advice and guidance on medication administration.